When we talk about the gaps in access to medicine, much of the challenge, I think, is really ensuring that medicines reach the patients. And this problem is often hindered by a lot of things, but one of them is the lack of regulation in countries, especially at the country level. So can you talk about what are the main hindrances in flows to medicine?
Yeah, it varies, but if we focus on issues that relate to policy and regulation, and you'll hear people talk about governance. Mm-hmm. What is the government doing to help assure access to medicines and that they reach the people? And it varies, but our finding is that typically in countries, it's that the regulations aren't updated enough to keep pace with what's happening, around the world and in the country. So we often find that the regulations are out of date. And so we tend to want to help countries update them and develop a system for actually regularly updating them and reviewing them, because things change. And what we also find is that while the regulations may be there on paper, it's really challenging for countries to enforce them. So part of the problem is really helping countries develop the skill sets and the capacity to be able to actually enforce the laws that are on the books.
Great. So for you, what's the next big thing in global development, and what should health actors kind of have on their radars regarding the future of access to medicine?
I'm laughing because for me it's not just one.
Okay, you can name as many as you want.
There are several. I mean, I think for me, we talk about medicines a lot, and we should, but there's also issues around health technologies, right? I mean, so there's issues about helping countries be able to diagnose, diseases and ailments that are quite relevant. We don't really talk about all the issues as relates to labs and all the things that relate to countries really trying to help a robust laboratory system to support the diagnosis and treatment. Mm-hmm. And so for me, that's really, really important. I mean, and it's going to become even more important with the advocating now finally globally about universal health coverage. Right, and as we expand access to health services, the demand for those health services obviously will increase. And so resources are going to become even more limited, and it's going to become even more important for those resources to be used wisely. And so I think it heightens the need for us to do more around strengthening the pharmaceutical systems. The other issue for me that is clearly big is around chronic diseases. I mean, most of the world still talks about AIDS, malaria, and TB, and we should, but people don't realize that as low and middle income countries become stronger and have more and advance more, they're experiencing many of the diseases that we experience in this country, for example. And there are issues around access to medicines for those. I mean, it's only 1 in 3 countries really has enough insulin to treat the people with diabetes. So that's big, and it's a very costly medicine. I actually feel very strongly about treating people to address their pain. Not many people talk about palliative care, but it's a huge issue, and people having access, and countries having enough medicines to treat pain. And we all were, really pressing countries to do something about the illegal, transport and use of illicit drugs. Well, one of the consequences of that was the laws were so stringent that many of those, medicines are quite relevant, for treating pain. Whether it's people with cancer or people with AIDS, I mean, it's part of the armamentarium of medicines that are quite relevant, and many countries don't have enough. And so for me, so you have people suffering, and what I would call needlessly, because the medicines really are available.